Courtney is a registered nurse with 20 years of experience in Australia's healthcare system, and she excels in operations, strategy, and patient care. She also serves on the medical advisory board of Operation Smile Australia, improving global surgical access. Courtney's leadership and passion for accessible care drive meaningful change in the industry. Courtney, welcome. The stage is yours.
Thank you. It's always interesting to hear about yourself from somebody else. So thank you for that, Yuli. And lovely to meet you all. I'm currently on the Gold Coast in Australia. So I know we're all in different time zones, but I like to think we're ahead of the game in Australia. We are in time for a lot of you. So I'm coming to you from Friday morning. Dr. Richard Lunds, who's also on, he's probably a bit ahead of me in New Zealand. So great to meet you all. As Yuli said, I'm a registered nurse. I chose to leave the institution, as I call it, about 3 years ago and join Beyond the Clinic as one of the founding team. And so I've been working there now for 3 years and really passionate about providing access to healthcare. I've worked globally throughout the world with Operation Smile, which is a children's charity fixing kids with or supporting kids and families with cleft lip and palate conditions. And I've really seen how technology can help provide that safe access to healthcare. We've seen in time how technology has changed how we order food, how we book a plane flight, and I think that change is happening with consuming healthcare as well. So let me get started and I'll tell you a little bit more about Beyond the Clinic. So the opportunity that we're involved in is that 1 in 3 people are living with joint and muscle pain, and it really impacts mobility and quality of life. Globally, the World Health Organization states that 1.7 billion people are living with joint and muscle pain or musculoskeletal conditions. So this ensures that there's a huge demand on our healthcare system. And as we know, globally in Australia, wherever you are, there's not enough clinicians for the demand and supply. So this is really impacting how healthcare is delivered and pushing those costs higher as well. So that is a real problem. And the bricks and mortar approach that we're traditionally used to in providing that face-to-face clinician-based care really limits access and opportunity for early access and intervention when people need it. So what we've developed, and there is enough evidence out there, including early intervention really helps that significant and economic impacts if we think about the scope of musculoskeletal conditions. So who is Beyond the Clinic? We're a proud clinician-led company and with a deep market expertise and domain expert in MSK. So our co-founder is an orthopaedic surgeon, Dr. Jason Sung, and Ali Stokes. And with our team, we have a team of nurses, physiotherapists, and an awesome tech team as well. So we really pride ourselves on that clinician-led digital health startup. And what we know is that we're trying to solve some of these big problems that we face in healthcare today. So we've been in market now for about 4 years. We've got 2 digital programs in market, and we've got 2 advanced corporate contracts, which are going well. And we've also had a successful seed round at the end of last year. So we're building our team. We're a team of 12 now, which is fantastic. And we're starting to see some real traction in the market. So one of our key focus is really reducing the burden on our healthcare system by developing value-based digital programs that can help manage care upstream and really looking at those value-based prevention programs. So the early evidence suggests that the bricks and mortar models of care are saturated in the market, but also what we need to see is that real hybrid model of care where we can get technology doing some of the heavy lifting and really supporting our clinicians with patient-generated data, but then teaming that with virtual support with our clinicians. So we've seen some really positive outcomes with our programs that are in market. with an NPS of about 75% or 8 out of 10 from our patient cohort. And we've also had 100% of participants report the confidence in managing their own care. And a lot of this is around behavioural change that we see within that first 6 to 8 weeks. So that's support of educating them and also knowing how to manage their conditions. 60% of patients also reported a decrease in pain and improvement in their function as a result of completing our programs. So our goal is to use technology and empower patients to self-manage. And a new initiative that I'd like to present today is also Project Mobilise that we've just launched in the last month here in Australia. And what we're trying to do is team up with channel partners to supply our programs to patients for 6 weeks and do a 6-month pilot, which I'll explain a little bit more. So how do our programs work? They're simple and a scalable model. People come into our program through using our joint health profile, and this is able to really give a risk profile of the cohort of patients and flagging that need for early intervention as well. So from then, we're able to automate a triage into a personalised exercise program and team that with our hybrid approach of telehealth and also physiotherapy support. Our main goal here is obviously to optimise patients if and when the disease states progress for surgery, or to support patients in that conservative management of osteoarthritis or other MSK conditions. So it's a simple step approach. I'll just play that again. I don't know why it always jumps. So step 1, patients come into the program and do the joint health score, as I said. Step 2, they are provided with a 6-week program that is either a surgical or a non-surgical or a conservative program. From then, they're prescribed a personalised exercise program, and we use vision-based technology to provide that program. We also team that with vital signs monitoring, where we do heart rate, blood pressure, and respiratory rate. And then we're able to provide a detailed progress report that the patient can take to their GP or their healthcare team. So why are people partnering with us? So we're looking at all areas of the healthcare system. And as we know, what we want to do is to really service those customers in that prevention space. So globally, there are 500 million people living with osteoarthritis. And in Australia, there's over 100,000 surgeries done annually. So it's really costly care when we're looking at that healthcare economic approach instead of the preventative approach. So we're trying to engage early with these patients to drive better outcomes together with patients and also strategic partners. So we're working together. This is our timeline, which I can go through later on, or all the details are on our website. But essentially, EOIs are open at the moment. We're looking to kick off the 6-month pilot with partners from the 1st of June, where referrals will come in, patients are allocated a program, and then at the end of the 6-month pilot, the partners will be provided with an offboarding report. So this will provide a valuable insight to the impact and also the health demographics of your cohort of patients, including mobility risk and other really engaging statistics. We are able to give a breakdown of program participation and engagement and report some really measurable outcomes. So in our patient profiling, we're doing PREMs and PROMs to really get that profile and provide that personalised care. And then obviously, what are the key learnings that from our program and that patient cohort as well. So as I said, those expression of interest are out today, so you can hop on there and have a look. And then happy to answer any questions. I know I've gone through the technology pretty quickly, but with 10 minutes, you have to get through it. So happy to open the floor up to some questions regarding Beyond the Clinic, our programs, and also Project Mobilise.
Great. Thank you very much, Courtney. So if anybody has questions, please raise your hand. I have a question. You say that you have a pilot, you're planning on a pilot. Do you have a partner that is willing to do a pilot with you, like an organization or clinic or a hospital?
Yeah, so we're looking at big volumes, Uli. So we need to see traction with where we're at with our startup at the moment. We've got some really good, evidence so far with the corporate contracts, but what we want to be able to provide evidence for is traction. And our aim is to get 10,000 patients on our platform this year, which is a big goal. But having raised that money last year, we need to show our shareholders we can do what we say we can do, and also that provides awareness in industry as well. So currently we've got 5 really exciting strategic partners here in Australia, from Arthritis Australia to 2 big university groups and another hospital group in Melbourne, Australia as well.
Great. Richard asks, let's see. What countries, actually Manzoor asks, what countries is it available in?
Currently, we're in Australia. We have also got connections in Singapore and the UK, but the way we've built the technology, and obviously with software as a medical device and TGA requirements in Australia, we have launched in Australia, but we have built our technology to be able to scale globally as well. So at this stage, we're still validating and in the market in Australia, but looking to scale.
Great. And Thomas had his hand raised. Tom,
yes, thanks very much. Just as a curiosity, are you familiar with Head to Foot Orthotics in the Melbourne area? They happen to be our Australia, New Zealand distributor for our product. But my question is a little similar to perhaps what Ely asked. It sounds like your current institutions that are involved in you are more research-based and they're interested in the outcomes and maybe feeding an academic interest. Who's your eventual customer? Who writes the check? Who wants beyond the clinic?
Yeah, absolutely, Thomas. And that's a great question. And look, as any health tech startup, you're looking for that market segment who is going to write the check. So we've developed this technology with private health insurers in mind, and that is our first customer was a private health insurer here in Australia. Obviously, with conservative management programs, their incentive is to defer and delay expensive hip and knee joint replacement surgery. So we've got great traction in there. And our other contract, which came a little bit left field, is medical device company with using our technology as a patient engagement tool for their prosthesis. So at this stage, that wasn't something we were looking for, but in any startup, you take opportunities and run with them. And at the moment, we're really doubling down on that primary care model. In Australia and probably globally, we've got a huge wait list problem in our public health system for hip and knee waiting lists. And really, our patients deteriorate and become really poor surgical candidates while they're sitting on those orthopedic waiting lists. So we're doubling down in that primary care space and looking at that market segment that in Australia has 2.1 million people with osteoarthritis, with not much other than take some, osteo-ease and do a bit more Pilates. So.
Yeah, I'm familiar with the waiting list. I did my fellowship in England, Stoke-on-Trent, in orthopedic trauma, and our goal for the healthcare directorate was get the waiting list for a total hip down to less than 2 years.
Yeah. Yeah, and after COVID here in Australia, there's some institutions that have blown out to 5 or 6 years for that waiting list, and you can imagine the comorbidities and the deterioration that occurs. Thanks, Thomas.
Courtney, how many patients have used the system so far, and what has their experience been? What feedback are you getting?
Yeah, currently we're just over 200 with our patients. And what we have really learned, our big key learning, is that hybrid model of care is really important. Our patients aren't yet ready for purely virtual. Okay, they need to know that professionals or clinicians are behind the technology. So once they can't come onto the program, we educate them and really teach them how to use the vision-based physiotherapy exercises and team that with telehealth appointments. The feedback has been fantastic, and obviously you can think of, you know, the traditional model of physiotherapy where we all go and we get a PDF printout that sits in the car for the next 2 weeks, and we all go back and go, yeah, of course I did my exercises. So that, you know, with our vision-based technology, we're able to get that compliance monitoring, so we can see real-life feedback. We get a little skeleton. We don't see any video of the patient doing the program, but we're able to ensure that they're doing the exercises safely, and also we can monitor and support and early intervention as, hey, you had 10 squats prescribed yesterday, you only did 3. What's going on? Oh, my hip's really hurting, so I thought I'd stop. So that real-time feedback that we're able to give patients, which has provided that confidence in patients and also really positive feedback.
Now, I'm hoping you're generating some revenue over there with these patients.
Yes, well, we're still in the valley of death of all startups, that's for sure. But with our 2 contracts with commercial companies are going well. So, and then obviously we're driving to be profitable by the end of this week. I'd love the end of this week. That's today, but end of this year is our strategic goal with our roadmap.
Good. Now, are you planning to raise any money, or are you done with the current raise?
No, we're looking by July, August. We're planning at this stage, depending on development of contracts. But at the moment, we are planning to do another round in July, August, and go for probably around 5 million. So we can really, what we see our program be able to do is, because we've got that profile of patients, we want to be able to integrate psychology, nutrition, and team that with that really holistic approach of the care of the patient, which we know surgical patients, let alone patients conservatively managed, need all of that in terms of their care. So.
And are you also looking at international expansion, or right now you're going to focus on Australia?
No, definitely. Yeah, we've been working hard on that. Ali Stokes, our CEO, did we've got the Oz Trade here in Australia, or the UK Launchpad. And we went to London Tech Week last year, and Dr. Jason Sung and Taylor, our product lead, are going to Singapore next month for their Asia Tech conference as well. So there are 2 markets that we're looking at in terms of expansion to start with, but this technology is built to be able to be used globally.
Great. All right.